And now this panel, we're going to have some very important perspective from a range of healthcare payers in Texas. We know that foundations like ours as well as others cannot cover ongoing costs of social care. So typically, we try to look at our healthcare payers to help create sustainability. With this panel, what we hope to do is that we'll have the opportunity to understand some of the issues and complexities related to paying for social needs targeted care. Each panelist will share a bit about their work that they are doing, as well as the path forward for them. They will also be talking about issues and challenges, things like the pull and the push factors, such as the need to show a return on investment, ROI, in a particular time frame, so that they are able to make a business case for supporting this type of work, value proposition. Before I introduce the panelists, a quick reminder on how the panels will work. Everyone other than panelists and myself should have their video off at this time. Each panelist will have about 8 minutes to speak. There will not be any slides. After all four share their prepared remarks, I'll take questions from the audience. If you would like to ask a question, please raise your hand. Similar to the session earlier, to raise your hand, open the participants panel by clicking on participants on the bottom of your Zoom screen. Click on your name and you'll see a symbol to raise your hand. At any time during the meeting, you can submit the information, comments, or questions through the chat box to the meeting host. If you have any technical difficulties, please send a chat and someone will try to help you out. Now it is my honor and privilege to introduce to you the four panelists. Again, we are keeping the introduction very brief so that we have plenty of time for conversation. But know that it's just such a great honor to have each one of them to join us this afternoon. To begin with, we have Dr. Ryan Van Ramshaw, the Chief Medical Officer for Texas Medicaid at HHSC. We also have Jamie Duden-Singh, the CEO for the Texas Association of Health Plans, and followed by Katrina Daniel, the Chief Healthcare Officer of Teachers Retirement System of Texas. Last but not least, we'll have Teresa Skipansky, Chief Administrative Officer of University Health Systems. She's also the interim president and Chief Executive Officer of Community First Health Plans. With that said, let me pass the mic over to Dr. V.
Thanks, Dr. Sim, for the introduction. Again, good afternoon, everybody. My name is Ryan Van Ramshaw, Dr. V for short. I'm the Chief Medical Director for Medicaid CHIP Services, and I've been in this role for just over 16 months. I'm really thrilled to be participating in this discussion this afternoon with the other panelists and the people that are in the virtual audience. I've had the pleasure of working or interacting with many of you and definitely enjoyed the first panel's discussion, and I know that this is going to continue thinking about this very important issue of social determinants of health and integrating that with the healthcare system. I come to this largely from the standpoint as a general community pediatrician, like Dr. Smith. The first 2 years of my practice, I was in the National Health Service Corps, and I was on the south side of San Antonio. I was the only pediatrician for a while at a relatively large hub clinic in a very underserved area. And I think many of the issues that we've already spoken about this afternoon, I saw on a daily basis. I remember one of the first kind of meetings I had with my medical director was around, was I on point with meeting certain quality metrics, which definitely factor into this conversation. And one of those metrics was the percentage of my patient panel that was overweight or obese. And I remember just thinking to myself, wow, how and what can I do to address that very complex multifactorial issue with my patients when I only have 15 minutes in the room with them, and thinking through what resources could I leverage, where was the closest YMCA, where was the closest food bank, did we have a social worker that could help meet with the families or the nutritionist? and really learned early on the value of being aware of those community resources. And I think to Keegan's comments earlier, I did have the pleasure of training in a residency program that did have a medical legal partnership, and definitely learned a ton from the value that brought to my patients and to our community. And so that's kind of the way that I approach this work is I'm a pediatrician when it comes down to it. So Texas Medicaid, as you may be aware, is a public insurance program that in Texas covers between 4 to 4.5 million lives. About 3 million plus of those lives are children. We also cover adults with disabilities. We cover pregnant women and a few other subcategories of people through our waiver programs. And it's important context to know that in Texas, Medicaid is largely managed care. And I know Ms. Dudensing, who's going to speak shortly after me, is going to touch upon lots of ways that our managed care organizations, or MCOs, are working to do great things in the space of social determinants of health. And of those 4 to 4.5 million individuals that are covered through Texas Medicaid, or CHIP for that matter, 95+% of those individuals are in a managed care program. So we have 18 different managed care organizations, 2, soon to be 3 dental maintenance organizations, and then we have a smaller portion of people that are in fee-for-service. So I think it's important context, especially for this panel, that's kind of how Texas has decided really over the past 20+ years to evolve our Medicaid program to be a managed care Medicaid program, which is similar to many other larger states and some smaller states for that matter. But we have many more MCOs than your average state does. So thinking of social determinants of health, I think there's a couple things that I wanted to highlight in my remarks here. And one has to do with the work of something called DSRIP, which stands for Delivery System Reform Incentive Payment Program, which is a part of what's called a Medicaid 1115 waiver that Texas was able to get to draw down additional dollars to take care of people on Medicaid, as well as the low-income uninsured. And so through that, the Texas Health and Human Services Commission, or HHSC, has partnered with providers from across the state to deliver Medicaid services and additional services to folks that maybe don't qualify for Medicaid. And social determinants of health does play a role in our DSRIP program. What you might have heard is that the state is in the process of transitioning away from DSRIP. And as part of that work, we have to come up with a transition plan, which we submit to our federal partners at the Center for Medicare and Medicaid Services, CMS. And that plan, which you can find on our website and we can make sure is shared with you, has a variety of milestones that HHSC is held accountable for. And one of those milestones is specifically around social determinants of health. And that milestone calls for a study of sorts, looking specifically at the Texas Medicaid population, looking at health outcomes, and looking at those social factors that have something to do with those outcomes. And really, for me, as far as I'm aware, this is the first Texas Medicaid specific social determinants of health study that we're looking to do. And this is in partnership with the EQRO, which is our external quality review organization, which is the Institute for Child Health Policy in Florida, which has worked with the University of Texas School of Public Health to look at this, to do this study. And while I mentioned that most of Texas Medicaid enrollees are children, we're looking at children, we're looking at pregnant women, but we're also going to look at social determinants of health for our adult populations as well. So I'm really, really excited to be the executive sponsor of that milestone. And I'd like to acknowledge 2 of the great colleagues I get to work with who are in charge of the milestone with me, Joelle Jung and Lauren Kaufel, who are also on the call. And so just a big shout out to them for all of their hard work. So that's one part of DSRIP. As you might imagine, there's many other milestones, there's core activities, there's other data that we're tracking. And through that work, we also have something called the Best Practices Work Group, where we have surveyed providers that are working in DSRIP to get their thoughts on a variety of things. We recently did a survey March and April of this year, so not very long ago, using a modified Delphi methodology to look at various milestones that folks are working with, and social determinants of health came up a lot, as you might imagine. We received feedback on the importance of community health workers. We heard how food insecurity screening seems like a good place to start when it comes to social determinants of health. And we heard other things like data sharing and the importance of that. We also received some feedback on alternative payment models and value-based purchasing, value-based payment. And we know moving forward, our managed care organizations, our MCOs, are looking to collaborate with providers in these new payment models where it's stepping away from a fee-for-service methodology and moving towards outcomes-based payment that may very well include social determinants of health. And we know that many of our MCOs, through the work that they've already been doing, as well as work through a learning collaborative, which I know Ms. Dudensing is going to touch upon, which has largely been supported by Dr. Sim, Ms. Marks with the Episcopal Health Foundation Center for Healthcare Strategies, is already going on. And so those are just a few of the things that I wanted to mention. You know, I did also want to mention that, you know, I've had the pleasure of working with Dr. Smith before, and she mentioned that she had submitted a topic nomination to add food insecurity screening to our Texas Health Step Well Child program. Again, our Texas Health Step program is how we operationalize a Medicaid benefit called EPSDT, Early Periodic Diagnostic Screening and Treatment, which is our Well Child program. And that topic nomination process, of course, is open to any stakeholder that wants to contribute to our Medicaid program. And so we've received her nomination to add hunger as a vital sign to our program, which potentially could include reimbursement, which is another theme that we have heard repeatedly from providers and MCOs, is that if we really want to support moving forward with social determinants of health in Medicaid, we also need to have a conversation on how we're going to cover that in terms of cost and how it's going to be paid. And so kind of going back to one of the questions that Dr. Sim and Dr. Neme asked the panel is, you know, what kind of outcomes are you looking for? So as the Medicaid agency, you know, it is very important that we are aware of costs and benefits, including return on investment. It's not the only thing that is important to us, but it's one of the most important things, given that we are using taxpayer dollars to fund our program. As you may know, Medicaid makes up a not insignificant part of the state of Texas's budget. We have to have a balanced budget. We do our budget in 2-year cycles. And so it's important for we at the Medicaid agency, in partnership with our MCOs, to demonstrate that there is value in this work. And we all know that that value is there. It's just sometimes being able to quantify that is a little difficult. So in the interest of time, I'll stop my remarks there. I'm looking forward to the discussion from the other panelists and questions from the audience. And again, I'm delighted to have been invited to speak here, and thank you so much.
Thank you, Dr. V. I'm sure we'll have plenty of opportunities for Q&A later on. So now, you know, why don't we turn to Jamie? Jamie, please.
Okay, can you hear me okay?
Great.
All right, great. As they mentioned, my name is Jamie Dudensing, and I help run the Health Plan Association for Texas, which includes commercial health plans, Medicare Advantage plans, and Medicaid managed care plans. And in some instances, all of these types of plans are invested in programs and initiatives that address these social barriers that make it harder for individuals to improve their health outcomes. I'm also a registered nurse, so I like to think about it as, you know, the Maslow hierarchy of needs. You know, like you're never gonna reach true health if you can't help people have food, housing, and basic needs that they need to make it up to the top. There's a lot going on around social determinants of health, especially around Medicaid managed care and Medicare Advantage. I am going to focus on Medicaid managed care, but I'm happy to answer questions in any of these three sort of pots of coverage that exist out here. I'm going to start off kind of talking about some of the findings that the collaborative and the survey that went on this, kind of big picture, what it takes for something to have widespread adoption in Medicaid managed care. What are some of the obstacles and barriers that we're seeing, and really kind of end with a positive note on the direction things are going. So to kind of get through my notes really quick, the survey initiated with the Learning Collaborative. I was going to try, it was like last fall that the collaborative got started and kicked off. It's currently a little bit on pause because of COVID, but it made really great work around getting this survey done. And Episcopal Health Foundation found a number of really interesting findings. One, a majority of plans, Medicaid managed care plans in Texas, do screen members for social determinants of health. They did find it was 79% for Texas. There was also a screen, the same survey happened in California. So I think it's interesting to have some comparison that in California it was 85%. So you're really talking about a large number of screenings that are already happening on their own within Medicaid managed care plans in 2 large states. Now for Texas, you did find that plans prioritize different determinants differently. In Texas, what we found was every single plan was really addressing food insecurity and transportation in some way, and 71% reported doing housing. If you think about it, and in the survey, cost was the major barrier for addressing housing needs. And at the same time, transportation and food insecurity are both issues that health plans have some track record of working on, especially transportation. But even on the food pieces of this, if you think about our Medicaid managed care plan, especially in STAR Plus, they've been offering food benefits for the majority time of the program. I was trying to think about how long it's been, for at least over 10 years, that they've been adding food as a benefit in the long-term care program of Medicaid, which is STAR Plus, on this process. So they have some knowledge about it. They know how it works. They're not as afraid to invest money in it, whereas housing is definitely much more of an expensive venture. The other interesting finding of the survey, which I would have thought more of it would have been ROI, return on investment, or cost savings that really drove them for making decisions around their investments in social determinants of health. But it ends up that as of right now, cost was extremely low on that. In fact, the top 3 factors that Texas Medicaid managed care plans found were that they had data reflecting that members needed it, their mission and value, and how it impacted quality. So cost and that overall ROI part was a really low piece of why they're investing what they're investing at this time, which means increasing ROI could definitely increase adoption of and investments in social determinants of health programs, alike programs. The other survey also found a few other things. One, that of course, if reimbursed, they would offer more assistance around food, transportation, housing, and employment. 10 out of the 14 plans said that their social determinants of health work benefited the entire community as opposed to individual members alone. And I'm going to talk about that a little bit, about this issue versus community versus individual. And plans did view reimbursement and other incentives as the most favorable steps that government could take to boost investment in social determinants of health. So kind of getting into some of the barriers that we have discovered as a part of this issue. One, of course, as I just mentioned, is funding. It is probably the easiest way to get it going, and the biggest obstacle for why you don't have widespread adoption is a funding issue. It is hard to track, and data and pieces of this is another obstacle. With Texas Medicaid, I think in particular, and this gets into this individual versus community situation, is that there's so much churn in Medicaid. Now, I think that's different. So if you take STAR Plus populations, those are the individuals that are older or have a disability, that are in the kind of the Medicaid managed care program that has both long-term care and acute care brought together. Those tend to have less churn. In addition to kids with special health care needs programs, STAR Kids, those programs tend to have less churn. But if you're just talking about family, moms typically, and the majority of the program, Healthy Kids, you really have a lot of churn in the program, which makes it really hard to invest in individuals and easier to invest in communities. And then, of course, proving ROI to shareholders, for plans that have to report to shareholders, and for even community-based plans that have to report to county judges, and taxpayers that are, some of this dollars comes from tax funding pieces, or us trying to prove this, as Dr. Remshaw mentioned, is that we have to prove to the state that it's good for taxpayers from the state side. So that ROI is a huge piece, and any kind of research, information that shows that return on investment is both, I guess, an obstacle that we needed, but could be a huge positive once we start having that type of research available. The last piece of this is that there's a whole lot going on in Texas. Plans are individually doing this, but the best way to describe it is that it's not really big picture and it's